Good morning, guys. Thanks a lot for coming along. This is Maurice. Maurice is quite hypoxic and we need to turn him prone. So I'm just going to take you through the process by which we do that. I'm Pete Walker. I'm one of the intensive care consultants.
I'm Patrick. I'm physio therapist of critical care.
I'm Nina, ACCS training.
Simon, Pierce, ODP.
Laurie, theatre orderly.
Okay. The bedside nurse has already prepared Maurice for this process, so she's put some eye protection on, she put some jellies on around the mouth ties so he does not get, or reduces the chance of any ulceration in the mouth while he is in prone position. So the equipment we will need 2 blue sliding sheets, we will need a third sheet, we will need a minimum of 5 but maybe 7 pillows, we will need some protective jellies to protect his nether regions, and also we will use his heel supports to protect his knees when he goes prone. Okay, so the first thing we will need to do is to get the blue sliding sheets in under him. So what we're going to do is we're going to use a ventilator as a reference point. So we've got the ventilator team and the non-ventilator team. So once you guys are ready, the non-ventilator team is ready, and then the ventilator side, can you reach over? And we're just going to do about a 20-degree roll just so we can slide the sliding sheets under. All ready? Any questions? Okay, ready, steady, roll. Okay,
Yep.
Ready, steady, down. And then if we can do the same in reverse. So if we can get the non-ventilator side ready to reach over, about a 20-degree roll, and the ventilator side, pull the sheet through. All ready? Mm-hmm. Ready, steady, roll. Ready, steady, down. Excellent. Okay, the next thing we need to do is to get him ready for proning, so to make sure all lines are secure. So first of all, we'll need to remove his gown, but so we can maintain his dignity, please. If we can get some towels to wrap his arms, just to make sure his arterial line and other venous access are safe and secure. Make sure that is wrapped. If necessary, you can make sure they're secure with a bit of tape. I'm going to move his ECG electrodes to the back of his shoulders so we can make sure his ECG is monitored throughout. Have we got the protector for his gentleman's bits?
We are missing it.
Don't worry. So we put the protector for his gentleman's bits back on. Don't worry. Okay, so next, if we can put 2 pillows on his chest and 2 pillows on his pelvis, having first pull the sheet up over his head and then roll down. And try to make sure they're in a reasonable position. Are you happy with that position, Patrick?
Yes. Yep.
Okay. Next, can we have a third sheet, or second sheet, to go on top of the pillows? So again, I need a little bit more up this end. Okay. And now, if you can just grab all 3 sheets together at the side and roll them together. I'm going to roll down to make sure his face is exposed. And we should end up with a fairly tight roll or tight crust either side of the patient. We've also previously made sure that his catheter is hanging straight between his legs and is not impinging anywhere. And lastly, I'm just going to slide his pillow out from under his head. Thank you. So this was a 3-stage movement. First stage will be to slide him along the bed away from the ventilator. The next movement will be to go onto his left lateral. We're going to pause there, swap sides with the hands. Once we've completed that, we'll then, the final move, put him prone. Any questions?
No.
Okay. Ready. On slide. Ready, steady, slide. Okay. All happy?
Yes.
Okay. Ready, steady, slide. Actually, now pause. Now, so the ventilator side patients, can you please take your right hand out and grab the roll on top? And the non-ventilator side, again, take right hand off and grab the roll underneath, which may be a bit tricky.
Yes.
Okay, Patrick? Okay.
Yep.
Now, ventilator side again with your left hands, grab the roll on top. And now non-ventilator side, the same.
Yeah.
All got a grip?
Yep.
Okay. So again, we're going to go down on roll. Just make sure I've got the tube. Okay, ready, steady, roll. Lovely. Thank you very much. I'm now just going to make sure, just have a pause, and make sure that he's still ventilating okay. Which he is. And monitoring is all still connected. Excellent. Okay. He could probably come up towards me because we want the head right at the top of the mattress. I'd like him to come up by about 2 or 3 inches. So we just slide him up. Okay, ready, steady, slide, stop. Beautiful. And now if we can unroll everything. Take the top sheet away, and can we make sure that he's kept decent, but we can then move on to, before we go further, sorry, can we just make sure that the pillows are adequately positioned under his chest and pelvis. Ideally, our nurse would help and check with this. If not, we'll show you how we would do this. So if we want to adjust the upper pillow, we'll have the 2 helpers at the upper end lifting the sheet closer to the patient, and then the 2 who are at the pelvis can reach in and help to adjust the pillows. Okay? Are you all ready?
Yeah.
Ready, steady, lift.
Yeah.
Okay, ready, steady, down. How is that? Is that better? Okay, excellent, thank you. Now if we can unroll the arms and expose them, excellent. And then finally, if we can get a gown back on him. Can we put a pillow? Once that is done, we just need 1 pillow under the shins. Thank you. And if we can put his booties back on, again supporting the lower limbs. This is all to help keep the toes lifted off the bed and reduce his chances of getting any pressure sores on his toes. And okay, and finally, I can't with this mannequin, I would put him in swimmer's position. So with this, it would be the ventilator side up above his head, like that. That position needs to be reversed every 2 hours. Okay? Are we all happy with pressure areas, etc.?
Yes.
Okay, excellent. Finally, we just need to slide the blue sheets out. So these need to be taken. If you try to slide it so it slides in on top of itself, and just pull it gently, the patient should not move. Just roll it down like that. Excellent, thank you very much.